Welcome to McDougall. Every woman who is over age 45 or ever wishes to be had better watch this show about heart disease. Hello, I'm Wayne Judd. And now, here is a cow's best friend, Dr. John.
I'm a cow's best friend because they don't have to go get milked all day, right?
That's right.
And because they don't have to go to the slaughterhouse all day.
They don't have to go to the slaughterhouse.
I think that's great advice.
Yes, you are a cow's best friend. That gives you a new status in life, doesn't it, John?
Well, that's a good thing to be known by. Sure. Actually, you know, when I was in my early college education, one of the things I took, one of the courses was in animal husbandry, and we had to go to a slaughterhouse.
And see it.
And it really made an impression on me. You know, possibly one way to change people's habits so that their health would be better would to ask them to go through that experience to see what really happens.
But isn't that pretty negative?
I suppose. It's a lot more brutal than picking a strawberry.
Wow.
Yeah.
What else can you say?
What else can you say? I would like to talk to you a little bit about heart disease. Now, this may be a little complex, but hopefully I can get the story across to you. What we're talking about here is disease of the arteries that supply the heart muscle. The heart muscle is not supplied by the blood that actually pumps through the heart. It has to be carried through blood vessels that run across the surface of the heart into the heart muscle to supply it. And these blood vessels, like all the blood vessels in the body, get clogged up due to sores. And we call these sores atherosclerotic plaques. And the process is known as atherosclerosis.
Okay.
Now,
that's caused by?
It's caused by eating that cow you were talking about.
Oh, okay.
And also the dairy and the cow.
Okay.
Now, what I used to believe, and this is the important thing for you to understand about this disease, I used to believe that what happened is these sores or these plaques grew and grew and grew and grew and grew until they closed off the artery completely. But that's not actually what happens. What happens in almost every case is you develop one of these sores, a small fatty plaque. In fact, a tiny fatty plaque. You develop one of these plaques that's stuffed with semi-liquid necrotic material.
Necrotic means?
Dead material, you know, dead white blood cells and so on. You develop one of these sores, and a tiny sore, it develops a little crack on the surface. And the inner contents come spurting out of that crack into the flowing blood and cause the blood to suddenly clot. And so we get a blood clot that is what actually closes off the artery. And we call that blood clot a thrombosis, and the same name for a heart attack is a coronary thrombosis.
Right, right.
Now, the reason it's important for you to understand this mechanism, Wayne, is it'll explain all kinds of things about heart disease that you may not have realized. One thing, it explains why somebody who's declared perfectly healthy, they've had an EKG, they've had an evaluation by a competent cardiologist, suddenly drops dead of a heart attack.
Yes, we had a good friend, age 41.
Right. The reason is because the disease that kills is from the small, tiny plaques that don't cause significant interference with the blood flow, and so it never causes chest pain.
Is there anything that can be done about this?
Well, we do things about it, and again, by understanding this mechanism, it'll explain to you what we can do and how it works. For example, you've heard of people with heart disease taking aspirin.
Yes, yes, I have.
All right. Well, what aspirin does is it thins the blood, so that when this tiny little plaque ruptures and acts as a catalyst to cause the blood to clot, if you're taking aspirin, then it keeps the blood thin, so you're less likely to form this blood clot.
So should we all take aspirin?
No, we shouldn't, because the risk from the aspirin is greater in people without heart disease than the benefits. So if you've had, say, a heart attack or bypass surgery or angioplasty, then it's a good idea, because you've declared yourself as somebody who's likely to have a heart attack. It's a good idea to take a little bit of aspirin.
So I shouldn't take an aspirin because I've never had any heart disease?
No, you really shouldn't.
Well, I've done that because I heard it was good for us.
Well, you shouldn't, because your risk of stomach bleeding and allergies and other problems related to aspirin are much greater. Now, the real important reason for you to understand this is it explains why, as soon as you change your diet, you reduce your risk of a tragedy. In other words, that little plaque rupturing and causing that blood clot to form. As soon as you change your diet, what happens is you take the tension off that plaque by starting the reversal process. So more cholesterol and fat are coming out than going in. And so the plaque becomes stabilized and it's less likely to rupture, and that happens within hours.
So it gets better.
Well, it gets stable and you reduce the risk of dying. The second thing you do is you remove the strongest clotting factor that the body comes in contact with, and that's animal fat. Animal fat makes that blood want to stick together and form that clot very aggressively. So as soon as you take animal fat out, you safely reduce the tendency to clot. And so changing your diet is the most effective tool for immediately changing your risk of heart disease.
Very interesting.
Was that clear enough?
Oh, it's really quite clear. I commend you on being able to communicate with a layman. No,
It's
really,
a simple mechanism, but it's one that if you do understand, you realize just how much control you have over your health. Well, we're going to be talking a lot more about heart disease, and we're going to get into some very important issues of women and heart disease, so please join us after this next commercial break.
For a brighter future, just say hello.
And welcome back. And with us is Marianne Legato, MD, internist. I thought maybe cardiologist, but internist and the author of a book on women and heart disease, and also a researcher in the area of heart disease. You have particular concerns, and I'm sure they go on beyond just being a woman, about the way women are treated in this country in terms of heart disease.
We do have the best healthcare system in the world, contrary to public opinion and world opinion, still. But I think women get short shrift sometimes from their doctors and from the system in general.
And how, I mean, is this documented, specific? Has anybody studied this,
Yes.
or is this just somebody rebelling against the male-dominated medical profession?
No, well, the males are not going to dominate much longer.
Oh no, we got a rebellion started here.
Well, it's interesting, Dr. Legato, to hear you say that, because my spouse, my wife, has been saying for years that this is the case, and she's in education, not in medicine,
Yes.
so there might be something to it.
Well,
She'll
you know,
love to hear this on the
when
show.
it comes to issues, women's issues, hysterectomies, breast cancer, and so on, I've heard this argument a lot, but it's something that's so much shared by the men and women as the heart. How could that be an issue that you see a bias?
Well, actually, men and women with coronary artery disease, which is really what I'm interested in, that's the clogging of the arteries that causes an inadequate blood supply to the heart, is manifested differently in men and women, surprisingly, and different treatment decisions are made.
Well, let's start about how it's manifested differently. When I was in my residency program, I'm an internist also. When I was in my residency program, one of the things that I was taught is that a woman who was still menstruating, who came in with chest pain, it was extremely unlikely that she'd be suffering from a heart attack. Is that true or not?
It really is not that true. The disease...
A little bit of truth, Joy.
A little bit of truth, in that the disease appears in general 10 years later in women than it does in men. But in 1992, there were almost 7,000 premature deaths from heart disease in women who were under 40.
And these are women who or didn't have diabetes, or
That's
didn't
right.
have hysterectomies, or
It's
have
a
their
very
ovaries removed.
underestimated disease, and the diagnosis is missed often.
Well, then if doctors are taught like I was taught, I suppose we would miss the diagnosis. Here she is. She's a woman. She's having chest pain. Women don't have heart attacks. She's
hysterical.
I had a bias that would keep me from making the diagnosis as often as I would, right?
I'm afraid so.
And that's what you're concerned about.
That's what I was concerned about.
You're not concerned about it anymore.
Well,
Men are
I think it's
okay
changing.
now. No, you don't believe that, do you?
I think men are wonderful.
I mean, there were just 2 studies published in the British Medical Journal, and with an accompanying editorial, on the mistreatment of women with heart disease. Do you recall those studies?
Yes, and it's been documented in Canada and Great Britain and the United States now that really we miss the diagnosis often.
We delay the treatment.
Women agree often that they can't be having a heart attack because it's not seen as a disease of women. And certainly, and this is the sorry part of it, many physicians write off symptoms in women as hysterical. The same symptoms that they would send a man to the treadmill for, they say, are hysterical in women.
Yes.
And I think that's the regrettable part.
Okay, and they're also there's less likely to have bypass surgery.
Yes. There is a wonderful cardiologist, Beverly Laurel, at the Beth Israel Hospital in Boston, who has just published and talked about a study in which it's clear that women and men with chest pain have different decisions made. Women have a much greater likelihood of being treated with medication, and men are sent on to angioplasty or bypass surgery.
And do you think that's an advantage?
I think the data show that women are twice as likely to die of their first heart attack as men, and that when they do finally get diagnosed, they're sicker and do much less well than their male counterparts. We don't know how much of that is because the diagnosis is delayed or missed.
And they're also diagnosed later in life, isn't that right? Or women
Yes,
will be
but I
diagnosed.
think that the big black box is still, are these women ignored because of the perception that this, quote, couldn't be heart disease? Or in fact, does it actually appear in a rather full-blown, much more serious state much later in life than men?
So what I'm hearing is that women women are ignored because there's some sort of perception on the part of men that women can't be trusted to understand their own symptoms, or what is
I think
this?
it comes in our medical education, don't you?
So it's part of the education as well, but the word hysterical, a hysterical woman, it intrigues me.
And women are quite intimidated by physicians often. They are easily quieted. They are easily dissuaded. They are ashamed or afraid to insist on being heard and on reasonable answers to their questions. And they are very often inarticulate to begin with. I have found that disappears very quickly if you say, when a woman comes into the office, she'll often say, I know I'm bringing this on myself, but I do have pain every time my husband and I quarrel.
Wow.
Perhaps it's all in my mind. And I think the most important thing to say to that patient is, it may or may not be, the point is you're experiencing chest pain. Tell me about that.
And a male physician is less apt to do that than a female physician.
I think many physicians, men and women, are taught that women somatize, that is, they put their stress and emotional problems into aches and pains more than men do. And they really are encouraged to write off women as emotional or hysterical.
Okay, who takes the
much
most
more easily.
tranquilizers?
70% of psychotropic medications in this country are given to women. That's an astounding figure.
That really says it all, doesn't it?
I have heard appalling stories
About tranquilizers.
about the way women are treated when they come in complaining of what turns out to be a very legitimate thing.
Write a prescription, hand it to
It's
it.
a quick fix.
And women are less inclined to argue with a physician than men are. Is that what you're telling us?
Well, I come from a big metropolitan city in which women are very articulate and have learned
there's more assertiveness.
how to really negotiate a solution to the problems that they want. But I think in general, women have traditionally been told to be nice girls.
Okay, but this is an
And to be
age-old
quiet.
problem,
Yes.
and what you're saying and what I would like to say is that as medical doctors, we ought to be able to step beyond this and to treat women equally
I think
as men. Is that
if
not
one
correct?
walks in,
Medical doctors ought to be better at this.
oh yes, yes, I think
We should be trained
I think
to do
being
this.
a good doctor is a daily struggle for being a better person. Don't you
Right.
think so?
I like that.
Oh, I think so. We're trained in the human being. We ought to be
Yeah.
the experts at it, but unfortunately
That's
we're not. We're going to talk about what to do to solve this problem with Marianne Legata. She's an MD and a person very interested in this, and we'll be back after this commercial break.
Hello.
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 And welcome back with me, Dr. Marianne Legato, MD, internist, and the book is called The Female Heart, The Truth About Women and Heart Disease, and you can get this in your bookstores. And we'll also have a number at the end of the show that'll tell you how to get a video that's put together called Shattering the Myths, which is really dealing with the subject
truth
that
about
you
women
feel
and
so
heart disease.
strongly about.
I do. I think it's a paradigm for what the American Medical Association has actually called attention to, that men and women are treated across the board in all specialties, or at least in many specialties, with the exception, obviously, of gynecology and obstetrics, differently than men are treated, and are much less likely to have high-tech interventions like renal transplants, for example.
Really? Very effective therapy.
It's very, very disturbing to read the report of the AMA on gender prejudice in healthcare, which was published in 1990, so it's not
Well,
that
but
old.
this has been a subject that's been around for, you know, a dozen years.
Yes, but I
and
think
things are changing or
Things
not
are
changing.
changing, and for the better.
All right,
happily.
now, you know, one of the arguments has been that men are actually being overtreated, and women are being treated maybe a little less. Do you agree with that?
I really don't. I have to say that if it's true that women are receiving just the right amount of treatment for coronary artery disease, which is the area I best know, why is it that they die twice as often as men, have
they're
a second
diagnosed
heart
later and they're
attack?
sicker. That's why, isn't it?
Yes, but I also think they don't have the same high-tech intervention with the same. They do not have as aggressive treatment. That's changing.
Well, there's been this great argument out there that that doctors have been too aggressive when it comes to bypass surgery. So there must be a little bit of equalization there.
Well, even given that,
Yes, you
if
just
men are being treated, overtreated, then why is there
Okay.
survival better? And why
How,
do they
then
do
how
that?
do we solve the problem? How do we, because we have a male-dominated medical profession. Now, obviously, one of the solutions might be to get more women in medical school, which they're doing, right?
Well, it's a very interesting point that you bring up. Women now sit in about 50% of first-year medical school classes. They still are not in positions of leadership, either in basic science, investigation, or in clinical medicine, with anything like the numbers that men are. So there is really and truly a glass ceiling.
But this is a
in the
recent
biomedical
change,
establishment.
the recent change, the 50%. Because when I went to medical school
yes.
over 20 years
Yes.
ago, we had maybe 10% were
I
female.
was one of 13 women in a class
Yes.
of 150.
So maybe it just has, we just have to wait. We have to wait until
wait and work.
we have to, yeah, but I mean, in time, with the larger percentage of women in medical schools, maybe this will help even it out.
It may.
But
But
you're
we
not
have to
confident.
promote women, advance them, and the NIH, you know, has established the Office of Research on Women's Health to help women achieve positions of real influence and power in the biomedical community.
Forgive me, but it seems to me we should educate men while we're waiting, too. I mean, I think that's what you mean when you say let's wait and work.
Well, I think, you know, I have 2 children, and my son's attitude when they let women into his exclusive school was very, very interesting to me. He hated it at first, but treats women very much more even-handedly now, I think, as a result of the experience. I think it's going to start
Interesting.
much earlier than medical school.
Well, I sure hope there's not a reaction where because of the concern, we start treating women inappropriately at the other end and doing too many things to them, too many tests.
Do you think men are overtreated?
Yes, I do. Yeah, I
Why
really
do you feel
well,
that?
because I feel the statistics show that. For example, Winslow's study showed that nearly half the bypass surgeries are done for equivocal or definitely inappropriate reasons. So it's a pretty good study to
I think
make the point.
even if you winnow those away, I think the tendency is to send men appropriately on for bypass surgery. And I have had personal experiences of traveling around the country and making rounds in hospitals where women just are not aggressively treated because they're women and women don't get heart disease, even when the data are right there.
So they get treated with drugs,
Medication,
though, don't they?
Yes, medication.
And there's great argument, has been great argument. I don't mean to take away from your thunder, but there's been great argument that that the treatment of coronary artery disease is done quite well with medical therapy. As an internist, I mean, you
It
understand
depends
that
on
data.
how severe or how extensive, right?
Depends on the criteria.
I think this whole argument will be moot when gene therapy
Well, let's not
comes to
talk about
flower.
something so far in the distance. How about diet therapy
for men and women.
for men and
Both
women?
very useful.
Do you think that we put more emphasis on dietary therapy for men than women, or you think there's no difference there
No,
at
I
all?
think that's pretty even-handed. I don't have the data. I haven't actually sat
Well,
down and
wouldn't you,
taken
as
the
somebody
pulse.
interested in heart disease, really like to see an emphasis on prevention?
Oh, sure. That's the name of the game.
And how about when it comes to risk factors like cigarette smoking and men and women? Do women more likely quit smoking cigarettes than men?
Well, the highest, to answer the question, the single worst thing that women, as opposed to men, can do, or the single most predictive factor is smoking in women, that they will have coronary artery disease and bad coronary artery disease. It's the absolutely worst thing that women
And
can
as far
do.
as response to the suggestion from a doctor to quit, is there any difference?
I don't know, but I can tell you that the highest increase in smokers is among white adolescent girls.
And how about when it comes to exercise? What I've always learned is that women are encouraged to exercise less in our society than men.
Women generally, in my experience and in the experience of most physicians, do not like exercise, resist it, and are not apparently...
That's a social thing, don't you
Yes,
think?
I do. I think it
I have a-
requires
I have a
education.
question. I'm
They
sorry.
also, excuse me, drop out of rehab programs, it seems,
Faster.
faster than men do.
My question is whether or not, and this may be simplistic, because women have traditionally lived longer than men, is that part of the reason why the formula, women don't die of heart attacks? They outlive us, we die of heart attacks while women live on?
I think that we miss the point that coronary artery disease in women at best is a postponement. It really happens a decade later. And the incidence of coronary artery disease goes way up at menopause. And as you know, women haven't lived to menopause until about the middle of this century. At the beginning of the century, the average life expectancy was 48 years. Women are now living
Yeah,
to
but
86.
some women lived to be.
Some women did,
Sure
yes.
they did. So there was coronary artery
But
disease.
yes, but the population of women is aging. And in the year 2020, 45% of the population will be well over menopausal age.
Yes,
So
yes.
that's kind of interesting.
Very interesting.
And we want to make sure that they get as good a treatment as men.
We hope so.
And I'm
Or
certain
good-
with your efforts. The name of the book is The Female Heart, The Truth About Women and Heart Disease. by Dr. Marianne Legato. And you're going to get people very interested, very stimulated to this subject.
So.
We're going to be back after these commercial breaks, and we'll talk a bit more about this and see if we can get some definite answers on what to do. That's great. Very interesting subject. Thank you very much.
Hello.
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 And welcome back. With us, Dr. Marianne Legato. We just asked the audience what cancer they thought women died most from.
What was their most concern?
Breast
their
cancer.
health?
Obviously, breast cancer. Isn't that right?
That's wrong.
That's what we
In
would
this
expect.
country, 500,000 women die every year of cardiovascular disease, which is more by half, 50% higher than deaths from all cancers combined. And the cancer killing most women is not breast cancer, it is lung cancer, which is a big surprise, probably because of smoking.
Mm-hmm. Because
and unfortunately, it's not reaching young women of that age who are the biggest smokers.
You said young white females.
Young white adolescents are the highest increase in smoking.
And
new
it hasn't
smokers.
been done much to change that, has there?
No, because it keeps them thin.
You think that's why they do it?
That's what they tell us.
So what do women worry about?
And young black adolescent women do not have this tremendous spurt in smoking when they reach adolescence, because being obese or heavier is not such a social issue. But with young white women, whom we teach they have to look like Twiggy to be attractive, they smoke to stay thin.
You know, you've taken on a tremendous project. This is going to be a lifetime for you to take and solve all these
Just
social
wonderful.
inequalities. The Female Heart is the name of the book. The truth about women and heart disease. I want to thank you very much
You're
for being
more than
very,
welcome.
very
Thank you
interesting.
for letting me
Pleasure to
come.
have you with us.
Thank you.
And goodbye. We'll see you next time.